school specialist here at Public Health. Thanks, Cami, for getting the recording. We got that going this time. I just wanted to start by thanking the Alaska Council of School Administrators and the Association of Alaska School Boards for getting the word out so that we could hear today from some public health experts here in Alaska about the latest science related to schools opening here pretty soon. And so we've got several people here online, Dr. Coleman Cutchins, Dr. Lisa Rabinowitz, Barb Pennington, our nurse consultant. I'm not seeing others, but we may have some others join us. And we're just going to let them start and do a presentation, and then hopefully open it up for questions specific to your district or to your situation. So Coleman, I think you're online to get us started. Hey, and I also wanted to thank the Department of Ed for and Education and Early Development for putting this together too, helping us. Coleman?
Yeah, thanks, Pat. And again, thank you everyone for joining in. I know these are difficult times. You know, the pandemic's been going on for a while. I do want to go through some slides briefly to go through the CDC school guidance that were released almost 2 weeks ago. And then CDC actually held a press conference today to update on some additional guidance for schools and for the community. But in this one, for the sake of time, I'll just go through the new school recommendations. Oops, all right, I don't think you can see my screen yet. Here we go. All right, there should be able to see my screen. All right, so we said thank everyone for joining. You know, we want to start strong going into next school year. You know, as you read through the CDC guidelines and the American College of Pediatrics school guidelines, the overlying main principle is that kids benefit from in-person learning, and we should do whatever we can to keep kids in school. Couple things just to make everyone aware. This is a screenshot of our dashboard from Friday. Is that you know, most of our state is now in the red. Unfortunately, you know, 2 weeks ago our whole state moved out of the red, and then now we're back in it, and we're having a pretty significant increase in cases around most of the state. And then also too, to let everyone know, our hospitals are very overloaded. You know, summer is the time of year when our hospitals are full anyway, not even without COVID. And now they're very full around the state. So that's another thing to consider, and another thing that's concerning. So really what's driving this, you know, it's a few things. It's you know, we're not doing the non-pharmacologic interventions like we were. Our vaccine rates never got up really high. Universally across the state. Some communities did a great job, you know, got up there, you know, 80+%. Some communities didn't. But really the other big driver is the Delta variant. I'm sure anyone who's seen the news has seen, you know, that Delta is concerning. So we're releasing another sequencing report probably later today. You know, this is the one from last week where over half of our positives were Delta. It looks like this week it's going to be at least 80%. So like the rest of the country, we're seeing is this Delta strain is really taken over in a very short period of time. You know, it is almost 100% of the cases in Europe are now Delta. Places in the US are at that, and it looks like we're going to be there very soon. One thing to mention with sequencing is we're always looking backwards about 3 weeks. The process of sequencing the viruses takes about 10 days-ish from the time the samples are received at the lab. So we're always looking backwards about 3 weeks. Unfortunately, that's as fast as it can go, but you know, that's kind of another thing to know about sequencing. So why is Delta spreading so fast? What it really comes down to is we talk about this R0 value. So R0 is, you know, basically how well something can spread from person to person. You know, when we looked at the original virus that came out, the wild type that came out of Wuhan, you know, on average, one person infected 2 more. So, you know, one case turned into 2, turned into 4, turned into 8. The Alpha variant, it was more like one person infected 4 to 5. With Delta, it's more like 5 to 8. So you think about spread, 1 turns into 8, turns into 70 something, turns into 400. So we see this precipitous increase in cases, and it's extremely easily spread. Measles is the most infectious disease that we know of. Its R0 value is about 18. Mumps is the second most at 12, but as we can see, Delta is very close to both of them. So extremely infectious, extremely easy to spread from person to person. And we can really see that with how quickly it's spread across the country and across our communities. So more on Delta, this was actually straight out of the CDC brief right before this. Like I just said, it is more spreadable. It went from less than 1% in May to over 80% in July. That was a very fast spread. Also, we have new data showing that people that are infected with Delta have higher viral loads. So that means they have, more virus in their upper respiratory tract, and which means they're spreading more virus around. Also, in contrast to Alpha, which was the B117 strain first isolated in the UK, which the Delta is kind of a mutation of Alpha. It's a variant of a variant that it's showing that vaccinated people, even fully vaccinated people who are infected, are possibly more infectious. The vaccines are still working. They're still, with vaccines, we want them to protect people from hospitalization and death and severe illness. But with Delta strain, we're getting more and more data that vaccinated people, although don't get very sick, can spread it. And it's just a matter of time before it gets to someone who's unvaccinated. So now on to the school guidance. So CDC put out these school guidance almost 2 weeks ago. I'm going to go through some of the areas with a little bit more detail, and some of them I'll just kind of breeze over. It really breaks it down to this layered approach. This is the new stuff that came out this morning. So just as of this morning, CDC recommends universal masking for all teachers, staff, students, and visitors to K-12 schools, regardless of vaccine status. It did stress that children should return to full-time in-person learning in the fall, but with layered prevention strategies. And one of the main layered prevention strategies should be universal masking, regardless of vaccine status. So key takeaways, like I said, is number one foremost, these guidance are to keep kids in school. They're not to count the number of cases. They're not to make things tougher. They're to keep kids in school. And the best way to keep kids in school is not dealing with COVID outbreaks and not having people get sick. The rest of this, let me move my bar here so I can read. And then we go through all of these guidance, vaccine status, masks, distancing, screening, testing, stay at home when you're sick, layered prevention strategies. And I'll go through a few of these as I go through. Oops. Oh, there we go. So American Academy of Pediatrics also came out with guidance. Again, the number one statement they put in here is everything possible should be done to keep kids in school. So primary considering for decision-making, these are the things you want to think about. What's your level of community transmission? What's your vaccination coverage, not only with those that are eligible, but also with everyone, since only people 12 and up are currently eligible for vaccine. How much screening testing are you doing? Are you having an outbreak right now? And what's the age of the children you're serving in the schools? So these are all of our our prevention strategies, that layered approach, using more than one of them. And the CDC guidance goes through each individual one in detail. So the first top foremost is vaccination. If we could have reached 90, 80, 90+% vaccine, we most likely wouldn't have the Delta spreading like we are now. The number one thing we can do to put this pandemic behind us is get as many people as possible vaccinated. Your adults, your family members, your community members, specifically them, for people who have kids under 12, they can't be eligible yet. In terms of update for kids under 12, Pfizer have finished their studies. They've finished enrolling in kids age 5 to 11. And we expect those vaccines to be available sort of late October to November-ish. As we get closer to that date, we'll have a much better idea of when it is. For kids 6 months to less than 5, it'll look more like early 2022. Those trials have not completed enrollment yet. The good news is, though, is for most of our middle and high school students, 12 and up, they are currently eligible for Pfizer vaccine, and we can get them fully vaccinated. basically looking through here, this is all based on science. The CDC press brief this morning, they really said this was not an easy decision. When talking about recommending universal masking, they did acknowledge that unfortunately it's been a political topic, but these guidance are not based on politics, they're based on science. When you go to the CDC website, they actually have a full science brief that accompanies the school guidance documents to show the studies and show why they made the decisions that they did that were based on scientific evidence and the studies we have and what we know about the virus and what we know about prevention. So I just want to encourage everyone, if you have questions about that, to look at that science guidance as well. Next part they really look at is consistent and correct mask use. They did update that. Prior to this update and clarification, they did say that all unvaccinated people should wear masks indoors. The clarification this morning was really based on the fact that, elementary age kids are not eligible for vaccine, and that even in the 12 to 18 group here in the US, we only have about 30% of that group vaccinated. So basically very few communities, if any, would have high enough vaccine rates, both within their community and within their eligible students, to consider not masking. This is, a part they put in here. So I think I really think the takeaway now is, universal masking is recommended for all schools, but these are things that you can do to, possibly make that not as much of a requirement, get your vaccine rates up in communities with low transmission, and then also think about how you can require that moving forward. So important to remember too, that even outside of the recommendation this morning, which is still a recommendation, it's not a requirement, but there is still a federal requirement for universal masking on transit, and school buses do count. So just like if any of you have flown, you have to wear a mask when you get on that plane and wear it until you get off that plane. School buses are under the same federal requirement. So masking on school buses are a requirement under the public transport federally. This is where the American Academy of Pediatrics recommended universal masking after the CDC guidance came out. Now the CDC has come up and straight recommended universal masking as well, for what I've already mentioned. Physical distancing, there's a couple things in here I do want to point out. So first of all, because of the importance of in-person learning, even when people are not fully vaccinated, if you can't maintain the 6-foot distance recommendation, they say stay in school. Being in school is more important than maintaining that 6-foot distancing standard. Also, they are still recommending cohorting. There's another interesting part I'll mention in a few slides about, last year they had that 3 to 6 foot kind of gray area where, people who are inside of 6 feet for more than 15 minutes are considered a close contact. Last year with schools, they extended some of it to 3 feet, but people that were, greater than 3 feet, but less than 6 feet are still considered a close contact. On a couple slides, I do have a clarification on that. Screening testing, CDC recommends people who are not fully vaccinated to do screening testing. If you are fully vaccinated, you do not need to do screening testing. Screening testing is when we test somebody without symptoms and without a known exposure. So even if you're fully vaccinated, if you have any symptoms that could be COVID, should still get tested, or there are some instances with a known exposure when you may consider testing. But for screening, asymptomatic, no exposure, screening testing is another great prevention strategy for people who are not fully vaccinated. This chart, I think, is really what you need to look at for screening testing. It talks about when to recommend screening testing. There's a couple things I want to point out because I like that they added this in here. So first of all, for communities in blue, which on our state map is green, students and staff do not need to do screening testing. However, for high-risk sports and activities, they still recommend screening activities, even if you're in the lowest level of community transmission. Again, that's only for people that are not fully vaccinated. They did add, it used to just be high-risk sports, but they did define high-risk extracurricular activities. Those are ones that involve singing, shouting, band, exercise, especially if indoors. So I do think that's a good thing to point that out. And I think this chart will be pretty useful for most of you. Ventilation, we do recommend thinking about your ventilation. I know since the pandemic, I've thought more about ventilation than I ever have in airflow and where I'm standing in relation to people. But there is a whole section on ventilation that wasn't really updated much from what was previously put out. Hand washing and respiratory etiquette. Again, this is another one that's pretty straightforward, same as it was last year. You know, we should wash our hands and we should be mindful, cover our coughs, wear masks, things like that. Staying at home when you're sick. This is really what we did last year with the symptom-free school. And it really cuts down on a lot of our other infections. You know, I don't know about you, but I think this is but this is the first, you know, school year last year was the first year that either me or my wife or either of our school age kids were sick. You know, it was kind of nice. But, you know, just thinking about continuing these policies for anybody to stay at home when they're sick, get tested if they have any possible symptom that could be COVID-19. Contact tracing, still recommending contact tracing in quarantine. This is where we have that exception. So anyone who is within 6 feet for more than 15 minutes cumulative of a positive case is considered a close contact. They have to quarantine for 14 days. There is this exception here. So in the classroom, if a student is greater than 3 feet, but less than 6 feet, universal masking is employed at that facility and both students or all students are wearing their mask, then those students in that 3 to 6 feet window could not be considered a close contact. So with universal masking, it really opens it up to allowing for a little bit less distancing without worrying about, you know, having a bunch of kids having taken out of school for being no close contact. So that I think was really good news that they updated that window. Cleaning and disinfection, really kind of the same as it was before, nothing new there. Another thing I do want to mention is really talks about the importance of vaccination for sports and extracurricular activities. And then also, you know, consider high-risk sports. So there's specifically, you know, contact sports, indoor sports, team sports where people can't distance, even possibly canceling them when your community is in the highest transmission, like most of our state is currently. Other extracurricular activities, it says, you know, think about the whole thing, not just what's happening on the field. You know, from what we've seen around Alaska and around the country, you know, a lot of times it doesn't happen on the field, it happens on the bleachers and after sports and things like that. Also think about the duration of time. The longer you're around other people, the more likely COVID is to get spread. School workers, they talk here really about considering your workers as well. Most of the guidance here is around students, but really think about your staff who maybe have underlying medical conditions. So even if they're vaccinated, it may not be as effective. So take them into consideration as well. Also here really recommends that all schools have an emergency operations plan. You know, what are you going to do when you have cases? What are you going to do when you have outbreaks? You know, I remind everyone a few years ago, we had a school in Anchorage that was shut down from a flu outbreak. So it's not just COVID, but it's important to be prepared for things like this. Vaccine verification, you know, this has been kind of a hot topic. Basically, they do address this in the CDC guidance. You know, schools require vaccines other than the COVID vaccine. So, you know, requiring vaccines for schools isn't a new thing. If you do want to verify vaccine or require vaccine, it's up to you and your district and your administrators, but do it in the same way you handle your other vaccines. Use similar policies, guiding principles to handle that information and to basically handle it how you do the other ones. We do have some e-learning modules. We'll be putting these out. Encourage everyone to be involved in our echoes and to watch what all the great things that Department of Health and Department of Education are putting out. And we have some contacts here, and from there I will stop and we'll be happy if anyone else has anything to add or be happy to take questions.
Feel free to put the questions in the chat or even take yourself off mute and ask. And if you haven't, it'd be great if you could put your name and your affiliation in the chat box as well.
This is Patty. I was just wanting to go back to the e-learning module and maybe have Cami or Sharon explain it. It's from Department of Education.
Sorry, I've got too many things happening on my screen. I'm going to go ahead and put a link in the chat as well that gives an overview of the overcoming anxiety and stress in Alaskan schools. And Sharon can absolutely speak to this. She worked really hard with a lot of folks to help developed this course, and we were seeing a lot of educators and school staff really, you know, with all of the stress around returning to school or just in general dealing with the pandemic, this is a great opportunity just to remind you all as school leaders that taking care of your staff is going to be a really, really important part of them being able to take care of your students. And so, and as well as taking care of yourselves as school leaders, making really, really difficult decisions right now. So Sharon, I'll let you take over there.
Yes, as Cammie said, the Overcoming Anxiety and Stress course that was just released like maybe a month ago will be really helpful for educators and school board members and administrators, everybody to take. We also have a self-care course that was released last spring, or I guess when right after the pandemic hit. All of this whole last year is kind of blending together. So we have a whole host of different courses about trauma, because all Alaskans, everybody in our country, around the world, everybody's experienced a traumatic event at this point with COVID and everything that's happening, and it's continuing. And so I encourage school staff to take a look, and administrators to take a look at some of these courses and view them and talk about them with your staff. Pat, you have anything to add on the courses?
No, I don't think so. I think we've got some questions rolling in. I guess I can read the first one here from Kathy Todd. It says, I thought quarantine had changed to 10 days plus observation or 7 days with a test. Is it now 14?
Let me pull it up because we do have a couple. So it's different between quarantine and isolation. I'll pull up our state testing guidance if you want to go on to the next question. I did put my slides in chat as well.
While you're doing that, Coleman, it says, does masking also apply to long distance buses as a law?
So it's any federal form of transportation. So any form of massive public mass transit.
So Pat, yes, to answer that question, long distance school buses would require masking, even to sporting events, to other communities.
Billy, it looks like you were gonna say something there.
Yeah, I don't consider me the expert on the bus thing, because ASAA doesn't actually charter the buses. But I think oftentimes when schools are doing that, they're chartering with a company that's not their normal school bus, if you will. And it might depend, there may be a little bit of difference in that, as opposed to if you're using the school bus as you're picking up students in the morning for school. Now, all that being said, as much as it is a pain, and I hated wearing the mask on the way to Juneau, I don't think it would be undoable to require the kids to wear a mask unless they're really spread out in a well-ventilated area.
That's exactly my point. I'd love to be able to say to my school district, where it's very political, that it's a federal rule, but we're chartering a private bus. It's not even a school bus. Does that apply to a chartered bus? As I say, I'd love to require masks, everybody all the time, but I'd love to be able to quote a federal rule.
Yeah, these are great clarifications, and I will get back to everyone on that. I'm not sure if it's a chartered bus, how that would be considered. So we'll get back to you on that.
In terms of the presentation, there's several questions about that. Coleman put the PDF in the chat. And also for those of you on the phone who probably can't pull that down, we will, along with the recording of this, send those to both the Association of Alaska School Boards and the Council of School Administrators so that they can post those on their website so that you can have access to those.
And Coleman, this is Joe. I don't know if you have the testing guidance up. With respect to quarantine, I'm sure the person is referring to the article that was published this past weekend, which actually was, yeah, you're right. The quarantine period that's currently recommended, 14 days is the safest, but you can do 10 days without a test. And then you can also do 7 days with a test. And I don't know, Coleman, if you have the testing guidance that you can show. I think we have that in the guidance.
We do, yeah, I have it pulled up. I put it in chat. So I'll share it so we can show. So here we have discontinuation of isolation. So these are people who do have COVID. So then we go 10 days after symptom onset. If they're afebrile for greater than 24 hours. And then down here we have, these are our quarantine options to end quarantine. So like Joe said, 14 days is the safest, but we do have these two options, 7 days plus a test, or 2 days with no test. And it does talk about, we do have it in here, the estimated risk if you're using one of those other strategies versus the 14 days. And I did put the full testing guidance in chat.
So there's a question here. It says, you mentioned that districts should treat these COVID vaccinations as we would others, but these are experimental vaccines and they are not required. So is DEED recommending we attempt to track these or not?
So first of all, I will say, in the CDC guidance, and this is not the state talking, this is CDC guidance, if you have a way to track, to require vaccines and you want to, then it's up to you to do it. They do recommend handling it the same way, if you go down that road. Again, there's a lot of ifs in there, but they do address it because we have these questions. I will add, these are not experimental vaccines. They are vaccines that are approved by the FDA. They've gone through clinical trials, they've gone through all the clinical trials, and they are approved under emergency use authorization. Once they get approved under emergency use authorization, they are no longer considered experimental or study, or actually the term that the FDA uses is an investigational drug. So, but it's no longer considered an investigational drug once it receives either full approval or emergency use authorization. And there are people that are requiring them, not any school districts that I'm aware of, but there are, private employers that are requiring vaccines for their employees. I know I'm sure all of you have read, there's a lot in the news about healthcare organizations requiring it here in Alaska and around the country.
And I might recommend that you just require shot records. I mean, there's required vaccinations that schools have to have anyway. So just ask everybody to turn in a shot record. That's a normal procedure. And that way you would have an idea if they had some of the extra vaccines like COVID vaccine on there.
Yeah, and this is Joe McLaughlin. Just want to say thanks to Coleman for clarifying that, what can be very confusing or misinforming information of, the word experimental versus emergency use authorization. So these drugs are no longer experimental. These vaccines, they are approved by the FDA. So just want to make sure we're really being very precise and careful with our language.
And this is Patty. This is one thing I noticed is that people are picking up on two terms. The one is authorized and the other is approved. And I was wondering if you could differentiate between the two, even though they're basically as good as approved.
Yeah, so, and there's a lot of confusion on the internet and a lot of misinformation on this. So first thing I want to be clear is we at the state of Alaska, at the Department of Health or the Department of Education are not telling you to require vaccines. So I want to be really clear about that. It is up to individual districts, and the CDC guidance does give you some help if that's something you're considering for some of the decisions to be made. So short version, emergency use authorization has been around for about 50 years now, close to 50 years. What it is a fast track process. So I've gone through drug studies. I've been principal investigator on drug studies before I moved to Alaska. The FDA process takes a long time. The reason the FDA process takes a long time is you spend a lot of time waiting for your spot in line. So I kind of equate the emergency use process like your fast pass. If you've ever been to one of those theme parks where there's like a 2.5 hour line and you get to fast pass it and go right to the front of the line, that's what emergency use does. It enables you to skip to the front of the line. So basically FDA drops everything and they review your data. You don't skip any steps. You know, if you're at the theme park, you still ride the same ride. You just get to skip the line. So with full approval, though, one of the caveats to full FDA approval is all of your ongoing trials have to be completed. So it's basically what happens at the very end of everything. So if we had gone through the typical FDA process to get full approval with these vaccines, we would have finished studying the adults close to a year ago now, and that data would just sit and wait. No one would evaluate it. Nobody would look at it until the very last trials were done. So some trials, you can wait 3 to 5 years between your first group gets done studying and your last group gets done to where you can submit. So the people in those groups, you know, the people who would have been eligible wait years and years and years. So if we would have gone through full process, the FDA would not have evaluated the data on the adults until the youngest group, which are the 6 month and up, were done. So typically in the process, you don't get full approval. It's kind of like everything's done. This is our stamp. Nothing else happens. Nothing else is done in terms of safety or effectiveness. It's just, you know, the emergency use allows things to happen before everyone is done. You know, I will add too, if we weren't studying this vaccine in younger people, like we would have full approval now for the adults. There's no reason we wouldn't. So again, I just kind of wanted to clarify that because there is, like I said, a lot of confusion. They are talking about possibly giving full approval to these vaccines because there's so much confusion over it before all of the trials are done. But if we follow the traditional road, we probably will see full approval whatever the last group is to finish. It looks like kids 6 months through 4, that'll be it. So when those trials finish up, they submit their data for the kids. The FDA goes through all of it and says, okay, it's approved. But I hope that clarifies, you know, that whole process.
And I would just like to say, I got an answer. I called Premier Alaska and they do require masks for students that they're chartering the buses for. That's just their policy, but we'll check into finding out if other chartered bus companies are under the same category. So, but most of you, I think, use Premier Alaska.
May I ask a couple of questions or make a couple of comments? So, you know, and as the state association of activities and extracurricular, we're really wanting to incentivize people getting vaccinated. So it was my understanding at one point that if a student had been vaccinated, then they were no longer considered a close contact if a teammate was tested positive. Is that the case still?
Hey, Billy,
Yeah.
Joe McLaughlin, maybe I can start with that one. So yes, so that is still the case. Anybody who's fully vaccinated, who has close contact with a confirmed case, they don't need to quarantine. But CDC's new guidance that just came out today recommends that they get tested between 3 and 5 days after that exposure.
Okay.
Yep, so you get tested, you don't have to be in quarantine, but then also for the full 14 days after that exposure, we recommend that people just be on the lookout. Do you have any signs or symptoms? Even if you test negative at 3 to 5 days, just continue for that full 14 days to really be vigilant looking for symptoms. And if symptoms develop, let's say you take a test at day 3 after exposure, it's negative, and then day 8, you wind up getting symptoms. We want, you know, anybody who has symptoms, regardless, we want them to go ahead and get tested. So that person would need to go in and get tested again.
And then,
Billy, this is Lisa. So your big question is, would you need to take kids out of competition if they were a close contact and vaccinated? And at this point, the guidance says you do not need to do that. They would just need to be tested, as Dr. McLaughlin said.
Well, unfortunately, what we kind of found out last year, it was almost easier to run activities if you were not doing in-person school, because if a member of your football team tested positive and you were doing remote learning, you weren't having to shut down 3 or 4 classrooms and so forth. So, you know, and I think the goal is to keep in-person learning happening and not to let activities jeopardize that. But at the same time, we all know the incentive that activities are in getting kids to come to school and so forth. So, you know, we would like to, we would be close to almost being wanting to say, you have to be vaccinated to attend a state tournament. But the flip side of that is I don't know if I have the legal defense fund to fight that. So, but if nothing else, we would, you know, will want to, you know, let parents and the students know that if you're vaccinated, you're less likely to not be able to practice, not being able to play, not be able to do some of these other things. Yes, if you catch the virus, you're going to have to be no longer, you know, sick in order to participate. But that's almost true of anything else that goes on throughout the year. The sick kids on your teams miss time. If I'm making sense there. Currently, right now, where my board left it is, we would follow the mask and pre-screening or testing criteria of the municipality in which the state tournaments are operated. But probably we would also add to that any vaccination requirements as well. And possibly we could adopt and I think it's where that verbiage of it, it's hard to require something that people think is experimental, okay? So, but I think I heard some of the superintendents this weekend saying they may require their students to be vaccinated in order to travel. And I think for the same reason the Supreme Court said we could drug test kids, I think we could also require a vaccination.
Yeah, and these are all great nuances as we move forward. And Billy, we would just love to offer that if ASAA needs any help or guidance or wants us to look over anything, we're always happy to set up an additional meeting with you guys.
Yeah, and we appreciate that. Thank you.
Pat, do you see the new message in there from Jenna? I'll read it.
Go ahead.
Can districts require a self-monitoring system such as the Protect Well app or comparable paper version for students and staff?
Barb, is that a question that you'd like to answer? Or I think there's lots of great tools out there. And
can you repeat it? I was answering another question, sorry.
Sure.
May districts require a self-monitoring system such as a Protect Well app or a comparable paper version for students and staff?
I'm not sure if you're talking about like temp checking before school. Is that what the question is referring to? Self-monitoring. I'm not sure who asked that. The schools have the option to have parents check temps and, you know, monitor their kids before school. So I don't see any reason why a self-check app would be anything different than that. Please let me know if I answered that question or not.
It looks like part of that question, Barb, is can districts require such a monitoring system, either on paper or a electronic app?
Districts have had that in their mitigation plans previously this last year that they required temp checks. So I don't think that should be any different. Each district is, you know, can make their own decisions. So there shouldn't be any issue with that.
These are great questions, you guys. Keep them coming. Don't be shy. This is great flow of information, and it's a great time that we can kind of collaborate and answer questions together. And you all have different insight from your different school districts. So sharing that information between ourselves is very helpful.
My name is Wendy, and I am a school health nurse consultant, and I'll jump in here. There is an organization called KINSA that provides school districts and families with free thermometers. And so it's a program that schools can opt in for to offer families who choose to opt in receive a free thermometer, and it's app tracked, and it's where the school nurse or someone in the school receives a dashboard that sees the data in a larger scope. It doesn't ever identify specific students, but KINSA collects this data and can see from a national perspective where hotspots might be, and they can predict those hotspots based on a morning check of temperature and symptoms. So it's something that I am also a boots on the ground school nurse in the Mat-Su Valley that I've implemented at one of our schools. We have another school that implemented it, and it's free to schools who want to do it. I can find the link and put it in the chat, but that's an option to offer parents the ability to self-monitor without it being a requirement, but an encouragement or just an option. And it's a super fun, easy app that is very friendly and appropriate for all ages of students.
This is Patty. While people are thinking up more questions and putting them in the chat, I just wanted to mention again the school health echoes that take place that are basically learning opportunities via Zoom that are every Monday now at 3 p.m. And yesterday we decided that our next Monday one will focus on screening testing. There's different options for screening testing. There's additional funding for screening testing. So we thought we'd take a little bit more time and go deeper into that. And I'm sure that we'll also have to review the new masking recommendations that were just announced today. So it's another good opportunity too for question and answer.
And also I'd like to add to that, this is Barbara. We had the school nurse lead from Kodiak present the Kodiak mitigation plan, and it's a really excellent plan. You can watch the school health echo, it's taped, and you can watch that. And it really was good, like Coleman was showing the chart to vary from like the green zone to the yellow zone and how their options would change. So their whole mitigation team and their medical advisory team came up with it. So just another example of, if you're still working with how you're going to, flow with the changing rates in your community.
So there's a question in about for districts not following the CDC guidelines, will the state be enforcing the CDC suggestions?
So I can start with that. So the state does not enforce these guidance that come out from the CDC or any other regulatory body. We are here to offer guidance and support, kind of let the school districts know the science behind the decision making, and happy to talk through any of the issues and offer testing supplies and support, but we will not be enforcing these. And as Barb mentioned, this is often a district to district decision that's made regarding this. And so that's done on the community level.
I'll add, even at the federal level, aside from the masking requirement for mass transit, these are recommendations as well. In the medical world, we always think of like guidelines and best practices. as like, this is what you should do to follow the science and the evidence, you know? So, and that's kind of what this is. It is a guideline and a best practice based on what we know so far. So it's not a requirement, but it is what the science tells us is the best strategy to keep kids in school.
And that's what I was going to say. It's designed with some flexibility in that layering, tailored just to in-person learning.
There is a question in the chat box from a board member wondering, they said at the last time there was an offer for public health to maybe meet with board members or districts, and they just wonder how they go about setting up that opportunity. So if someone could address that, I bet the boards would appreciate that.
This is Patty. I'll put it in the chat, but and it was on the last slide that Coleman presented, but we have a general, for all your school health questions, including COVID questions, a general email now called schoolhealthandsafety@alaska.gov. And you can contact that email and we'll forward it to the right people to provide either answers to your questions or provide that one-on-one technical assistance that you might be requesting.
Another thing I'll put out there too is we do have our Speakers Bureau. So Dr. Rabenowitz and myself are both on the Speakers Bureau. What this is, it's a group of medical providers who will come to your group and talk about vaccine, answer vaccine hesitancy questions, one-on-one. You know, we'll do it for Rotary clubs, for employers, for school boards, for anyone. And I'll put in the link in chat as to how you can request a Speakers Bureau speaker. And that's a good tool as well.
There's a couple questions that get around to this idea, and I'll read Paul's. How much consideration should isolated communities take in regard to mitigation, testing, quarantine protocols, where vaccine rates are high and COVID-19 spread cases are low to zero?
You know, I guess, Joe, if you want to talk about this more, but I will remind everyone, I mean, our state is pretty closely linked, you know, and if we look up, pull up a couple dashboards here. So if we look at the dashboard right now, so here's our case dashboard currently today, you know, I mean, let alone we don't have small areas, and isolated communities may have lower than this, but this is our alert level today. The entire state is in either the red or orange, so one of the highest two alert levels. You know, there's only 3 places that are not red or orange, and 2 of those have pretty low testing rates. If we look at the vaccine dashboard, you know, this is everyone. So, you know, our default or age is 12 plus, but when we think about schools, a lot of kids aren't eligible under 12. So this is our vaccine dashboard. You know, we have different colors on here. You know, the vaccine rates aren't defined, but, you know, a good way to look at this is dark green is really what we would consider probably high. These bottom 3 categories are what we would consider low. These next ones are moderate. So if you kind of think about it that way, you know, we really only have one part of the state that would be considered more high, a couple here that would consider moderate, but the vast majority of our state, especially where most of our urban areas are, would really be considered kind of lower or low.
And this is Joe, I can add to that. You know, there are some areas that are still in the orange in Alaska, and, you know, that could have to do also with testing rates. Are people doing enough testing in those regions? I saw that Fairbanks is still in the orange, whereas, you know, much of the rest of Alaska is in the red. And so you have to look at that as well. How much testing is being done? How much are people who are infected going in to get tested, especially folks who have mild illness? And so those are, you know, there are just a lot of unknowns that we can't really fully account for. We can look at percent positivity by the state, at the state level, things like that. But in terms of the question of, okay, if you're in a community that you know has really low transmission rates and very high vaccine coverage rates, then certainly I would personally feel more comfortable going into a store without a mask because I'm fully vaccinated. But as Coleman mentioned, we right now we're in the thick of tourist season and people are all over Alaska and traveling around from folks from the lower 48, folks from Europe and elsewhere in the world. And then Alaskans are traveling. And so it's going to be very, very easy for a region to go from having low incidence to high incidence. Now, we do have some communities, especially, some villages and whatnot, that have really high vaccine coverage rates, like 90% plus or something. And that's amazing. And so we would expect that, we wouldn't see a lot of big outbreaks in those communities unless they occurred in kids. And so, we know that the vaccine is not currently available for children under the age, a certain age. And so, if you're under 12, you're not going to be vaccinated. And so we're likely to see outbreaks occur more, in those regions that have high coverage rates among people who are eligible, but there's still virus circulating. I would guess that we would be more likely to see outbreaks occurring in those younger cohorts that are unvaccinated.
This is Susan with the North Slope. We also need to keep in mind that there are people who live off slope or live out of Alaska, and they're not counted in Alaska. So when you look at a vaccination region or unvaccinated region, you need to keep, we can't count those. So if you have the oil industry, those don't get counted. And so I like the idea of I wish we could not count them all together and they don't skew the numbers up here on the North Slope and make us so light green. But we can't because their residency is not in Alaska. And I'm sure that's the same way with a lot of the fishing industry guys.
That's a great point, Susan. Thank you for making that. Yeah, so there are a lot of sort of nuances to all of this. But in terms of the question, hopefully the questioner got an answer that was satisfactory. If you have any follow-up questions, feel free to let us know.
Will rapid PCR test kits such as Q Reader be available from the state for districts? It's from Jenna.
So we do have Q devices, and we also do have rapid antigens. Actually all of the rapid antigen tests that we've sent out will expire by the end of August. So if districts have tests on hand, I encourage you to look at your expiration dates, because if you got them from us, they're probably going to expire. We are in the process right now of procuring more. We waited till the end, so the ones we get will have the longest expiration date. So we're getting another batch from Abbott here soon, and we're hoping that those will have expiration dates on a Binax test that'll get us through the end of the fall, or at least close to it. We do still have plenty of Q readers and Q tests. Those are a rapid molecular, and they can be requested through the state EOC the same way as other. I'll put my email in here if anyone has questions about how to get supplies. Please reach out.
This is Wendy. I'll put my email in the chat as well. I help with CLIA waivers and getting started and all the contact information with the right people at the state level in order to get that process going. And if you email me, I'll send an email that is kind of a template email that has a whole bunch of attachments that will help direct you in that process. And then you and I, if you have any questions, I'll help you through that.
And this is Barbara.
Let's just put Wendy's email in there. She put together a really great testing resource document. Really put it all together in one place well.
Yeah, and this is Barbara. We brought Wendy on board with some of our COVID funding to help the smaller school districts that don't have school nurses. So please utilize her. She was collecting data last year and she just works part-time, but she's totally available after her Mat-Su school district hours too and responds to emails. So we really want to make sure that those of you in rural school districts that don't have a school nurse medical support, that, you know, we offer our services to you.
Great. Here's a question. Does the Delta variant pose greater risks for severe COVID or worse for children 5 to 11, 12 to 18 compared to the Alpha variant or influenza?
You know, I can start, and then I'm sure I'll go ahead, Lisa.
I was just going to say, I'm not sure if Joe popped off, but we are learning more and more about the Delta variant. We obviously know that it's much more transmissible, as Coleman kind of went through in the slideshow. There is also concern that it could make people more sick. There's been some international data that indicates that that may be a likelihood, but we just don't have enough data yet, or data in the US to definitively say that. We have seen an uptick of hospitalizations in younger people in the US over the last month that is being driven by the Delta variant, but a lot of those individuals have been unvaccinated as well. So you know, there's many factors in terms of hospitalizations. We do know that, as Coleman mentioned, these vaccines, they're very effective, and especially for severe disease, hospitalizations, and death. So we're learning more about the Delta variant. We'll keep you updated as we know more about the virulence of it. But at this point, we just need to keep moving forward and use the protection that we know works, vaccinating, and mitigation efforts.
So we'll add to that, and I've been on a few national calls where they really discuss this. So, you know, teenagers, you're more likely to get severely ill from COVID than the flu, which is really why when they looked at the vaccine studies, why they did that cut point at 12, you know, to try to get protection from the people at higher risk. Now, some of the things we don't know is, if we look at the whole pandemic, the driver of cases have been the 20 to 29-year-olds, followed closely by the 30 to 39-year-olds. Those are the people that have been mixing through the pandemic. You know, they're the ones who may have had jobs where they couldn't telework. You know, that's kind of your most social years, when you're out and about and you're socializing, you're around most people. You know, kids really, from a lot of the places in the country, didn't do much mixing last year through the height of the pandemic, and that really protected that as being one of our lowest age groups in terms of cases and in terms of infections. So we just have a lot of unknowns. You know, at this point, I think we should try and not get COVID, regardless of how old we are. And I think we have pretty good evidence to say that's, you know, our best strategy of this moving forward.
And one more thing I'll add, and we've talked about this on other meetings, but really the long COVID or post-COVID symptoms we're learning more about. And we don't know a lot about what that looks like in kids, especially younger children. But we're starting to see more smaller studies come out in terms of long-term effects on kiddos. So I think it's another incentive to really encourage vaccinated in that eligible population. So we're not looking at a group of kids with long COVID symptoms moving forward.
Well, we're right at 1 o'clock. I just want to thank Dr. Rabinowitz and Dr. Coleman and Barb Pennington and Dr. McLaughlin for all the great information, and Dr. Parody and her team at the Council of School Administrators, and Timmy and your folks at the Association of Alaska School Boards for you know, putting out the word so that we could give people the science information that they need to help them make those decisions locally. So thank you to everyone. We will get the recording out with as many of the links and documents as we can to both groups, so that you can receive those either via email or be posted and review it. And for those of you on school boards, please share it with your fellow board members who couldn't attend if you think that's a great idea. Thanks for attending. Cami, will you do a breakout room for the hub team, please?